This is part 2 of Chapter 4, Nutrition 230. First, we're going to talk about regulating blood glucose. So in order to provide a steady supply of glucose to the cells, the concentration of glucose in the blood is regulated by the liver and by enzymes secreted from the pancreas. Glycemic response refers to how quickly and how high the blood glucose rises after carbs are consumed. Glycemic index is a ranking of how a food affects the glycemic response, and the glycemic load is calculated by multiplying a food's glycemic index by the amount of available carbohydrate in a serving of food. So glycemic index is just going by grams of carbs in a food, comparing gram for gram, and glycemic load considers serving size. When blood glucose rises, the pancreas secretes insulin, a hormone, that then stimulates blood glucose to be distributed from the blood to cells. There are insulin receptors on a variety of cells, including muscle, fat-storing cells, and the liver. Glucose is then deposited in muscle cells for immediate use as energy or for storage as glycogen. Insulin's deposits glucose in the liver for storage as glycogen, and then insulin stimulates glucose to be converted to fat if there's nowhere else for those calories from glucose to go. So glucose, if we eat too much of anything, that pathway to the fat storing cells is sort of the last effort there. This causes blood glucose to be in normal range again, so it decreases blood glucose. Several hours after a meal, blood glucose level dips. This causes the pancreas to stimulate another hormone called glucagon. Glucagon then reports to the liver, where glycogen goes through gluconeogenesis to create glucose and release glucose back into the blood to normalize blood glucose levels again. In a healthy individual, this is happening all the time after a meal without us having to think about it at all. Once deposited in energy-providing cells, glucose is metabolized through cellular respiration, or aerobic metabolism, which we talked about a little bit in Chapter 3. Cellular respiration produces ATP, our form of energy currency, and this metabolic pathway uses 6 molecules of oxygen to convert 1 molecule of glucose into 6 molecules of carbon dioxide, 6 molecules of water, and about 38 molecules of ATP. So this is a highly efficient system. And cellular respiration converts glucose to pyruvate in the cytosol of the cell, which is anaerobic metabolism that can happen producing a little bit of ATP if there's no oxygen available. However, if there is oxygen available, that pyruvate is converted to acetyl-CoA, which then enters the citric acid cycle and transitions into high energy electrons that go through the electron transport chain in order to produce the water, the ATP, and the carbon dioxide. Gluconeogenesis is the process of converting pyruvate to oxaloacetate and back to glucose, and that's when glycogen is broken down. When there's no carbohydrate available, acetyl-CoA can also create molecules called ketones. Ketones can create some ATP when there's no carbohydrate available exogenously, and ketogenesis is used in times of starvation if somebody's on a low carbohydrate diet or in uncontrolled diabetes. Abnormal blood glucose is called diabetes when blood glucose is too high. Diabetes is the leading cause of blindness in the U.S. and accounts for about 44% of all new cases of kidney failure. Gestational diabetes occurs in women during the second trimester of pregnancy, and there may be an increased risk of developing type 2 diabetes later in life. In addition to gestational diabetes, diabetes can be classified as type 1, where insulin is no longer made by the body. This is an autoimmune reaction that typically happens during childhood. We used to actually call type 1 diabetes childhood onset diabetes, but because so many children are now being diagnosed with type 2 diabetes, we don't use those terms anymore. Type 2 diabetes has insulin present, but the cells do not respond. Another term for this is insulin resistance. This typically happens when people have certain lifestyles, such as overconsumption of energy-dense food, high sugar intake, low activity level, but there is some nature and nurture in there too, and it's partially genetics. Immediate symptoms of diabetes include excessive thirst, frequent urination, blurred vision, and weight loss, all of which are because glucose does not have the ability to get into any cells in order to produce energy, and thus is trying to be excreted from the body from any mechanism possible. Long-term complications can involve damage to the heart, blood vessels, kidneys, eyes, and nervous systems. Infections are much more common in patients with diabetes, and amputations could be necessary. So as you can see here, here's a picture of all of the different complications that result from damage to the large blood vessels as well as damage to the small blood vessels. The goal of diabetes treatment is to keep blood glucose levels within normal ranges. This can be done through a variety of ways. In type 1 diabetes, blood glucose really needs to be monitored regularly, and medication must be injected to give an exogenous source of insulin, since insulin can no longer be made, because in type 1 diabetes, an autoimmune reaction causes the beta cells of the pancreas to be destroyed where insulin is made. On the other hand, in type 2 diabetes, diet can really be used to avoid rapid or prolonged rise in blood glucose, and can be carefully planned with the help of a registered dietitian. For nutrition majors, a diabetes educator could be one route that you specialize in, either in a hospital or in an outpatient facility. Regular exercise also helps control blood glucose. A change in the amount of exercise a patient participates in can really change the amount of food and medication required to keep blood glucose in the normal range, even without weight loss. On the other end of the spectrum, we also have hypoglycemia. Reactive hypoglycemia results when oversecretion of insulin in response to carb intake is present, and the treatment is frequent small meals that include protein throughout the day. Fasting hypoglycemia, on the other hand, is abnormal insulin secretion that's not related to food intake. Usually fasting hypoglycemia has some sort of other health concern that's going along with it. The one way that carbohydrates have really been found to impact health negatively is through sugar. So we can only say that diets high in added sugar that contribute to high energy density and overconsumption of calories could be correlated to type 2 diabetes. On the other hand, we can say if you eat too much sugar and have bacteria in your mouth, plaque formation and acid production can lead to the dissolution of tooth enamel and formation of dental caries, which we tend to refer to as cavities. A lot of people these days talk about low-carb weight loss diets. The rationale for these is that foods high in carbs stimulate the release of insulin, and insulin promotes energy storage, mostly from fat. The more insulin you release, the more fat you store. Low-carb diets cause less insulin to be released, and with low-carb diets, the body produces ketones, and ketones help suppress the appetite. So if somebody asks you, why do low-carb diets help you lose weight? You could go through this series of factors that would cause that. In addition, low-carb diets decrease glycogen, which decreases water retention. So often people lose water weight when they initially go on a low-carb diet. Carbs and heart disease. So diets and whole grains have been found to reduce the risk of heart disease, and this is due to the effects of soluble fiber. Soluble fiber can bind dietary cholesterol in the small intestines and reduce absorption. Cholesterol is secreted into the small intestines not only through the diet, but also through the formation of bile. So if bile is secreted into the small intestines and soluble fiber grabs onto it, as well as grabbing on to the dietary cholesterol that's taken in, then over time, cholesterol can be reduced. You might see the health claim on things like Cheerios or oatmeal that says, if you have, Cheerios every morning, you'll reduce your cholesterol. And that relationship is due to the soluble fiber in the oats that make up the Cheerios. When we look at diets high in fiber and indigestible carbohydrates, they can also help with GI disorders, such as bowel disorders. They can relieve or prevent certain bowel disorders, such as hemorrhoids, diverticulosis, diverticulitis, and constipation. And remember, in Chapter 3, there are some more specific guidelines for what each of these types of bowel disorders entail. Epi studies have also shown that the incidence of colon cancer is lower in populations that consume diets that are high in fiber. Data from intervention studies, however, does not support those studies, so more information is really needed. Remember, when we look at different types of studies, we have the correlational studies, and then we have the cause and effect studies, and then we have our intervention studies, which are really getting down to the cause and effect of the matter. So if we want to assess our carbohydrate intake, we can calculate the percent of energy from carbs. Remember, the AMDR, or acceptable macronutrient distribution range, is 45 to 65% of total calories from carbs. So we can calculate the energy from carbohydrates by understanding that carbs provide 4 calories per gram. We can multiply the grams of carbohydrate by the 4 in order to calculate the total energy from carbohydrate, or how many calories we eat each day from carbs. Then we can calculate the percentage of energy from carbs by taking that number and dividing it by total calories and multiplying by 100. So for instance, if a diet contains 2,500 calories and 350 grams of carbs, we can say 350 grams of carbs times 4 calories per gram equals 1,400 calories of carbs. 1,400 calories of carbs divided by 2,500 calories total times 100 equals 56% of energy from carbohydrates. This falls within the AMDR, as 56% is almost spot in the middle between 45% and 65% of the recommended intake. We can also use exchange lists, which have been developed by the American Dietetic Association and the American Diabetes Association to estimate carbohydrate content. These are often used by diabetes educators in order to teach patients how to portion size and make choices as an alternative to Choose My Plate. Different food groups have different amounts of natural carbohydrates. So as you can see here, groups are separated a little bit differently than Choose My Plate into the starch, fruit, milk, other carbs, vegetables, meat and meat substitute groups. And so you can see that there's a variety of different given carbohydrates for each of those and the portion sizes. You can also estimate the fiber content of food. So a high fiber food has 4 to 5 grams per serving. A medium fiber food has 2 to 3 grams per serving, and a low fiber food has 0.1 or 0.5 to 1 grams per serving. And as you can see here, spanning across all of the different food groups, a variety of different types of foods have different amounts of fiber. When we look at carbs and Choose My Plate, we want to make sure that we're focusing on the most nutrient-dense sources of carbohydrates possible. We want to focus on foods that come in their most natural form, that naturally contain more fiber and natural sugars, and a combination of fiber and starch. On the other hand, we want to avoid things that have added sweeteners, that are refined carbohydrates. Even if they're enriched and fortified, remember they don't contain all of the nutrients and phytochemicals that were originally in the product. So by making good choices in terms of carbohydrates, we can incorporate that 45 to 65% of total calories of carbohydrates in our day, enjoy a variety of carbohydrates from a variety of different food groups, and still meet our overall nutrient needs.